Welcome to Wednesday's edition of COVID-19. A grim milestone yet again here on the local front, with authorities recording at almost 1,900 new infections over the past 24 hours. And with no end that is, in sight of the pandemic, some countries are choosing to shift their strategies. Now, we have details on that later on the program. Here first is our Sua with the broader update. Now, so let's start with our fresh high then.
Sunny, the fourth wave of the virus seems far from over. As you said, it's the highest ever daily caseload Korea has ever posted since the pandemic began here. And there are concerns that health experts' expectations forecast that is could become reality of the country surpassing the 2,000 threshold. Now, 1,896 infections were reported as of 12 a.m. this Wednesday. So it's the first time also that domestic transmissions have surpassed 1,800. Now, although it's nothing unusual to see a peak by the middle of the work week, a jump by 540 is concerning. And also the daily average in the past week of domestic transmissions is close to 1,500. Now, cases have been steadily rising on week if we take a look at the Wednesday figures here, but we have to consider that last Wednesday we had an unprecedented number of imported cases added to the tally due to a massive infection on a vessel that was in Africa and then returned to Korea. But even with that, we are seeing an on-week rise here. Now, with that, the total number of cases in Korea has surpassed 193,400, and the death toll stands at 2,083 with 4 additional fatalities. Now, a difference that we are observing this Wednesday is that the proportion of cases outside the metropolitan region has dipped. It was at around 40% in the past 2 days, but actually over 600 cases occurred in this region. So that means the proportion went down, but the figure of cases did actually go up. And also, if we take a closer look at our map, we have the capital Seoul and Gyeonggi-do province both at over 500 cases, and that means a rise by more than 200 cases here in Seoul. Also, again, a triple digit here in Busan, and all 17 provinces or major cities have been affected, that is, with at least a single digit figure.
Right. So how are authorities here assessing the current situation?
Well, Sunny, for that, let's take a listen to an assessment made by a senior health ministry official this morning, who has also been calling on cooperation from the nation's people when it comes to social distancing.
The fourth wave has been characterized by fast and silent transmissions, with people unwittingly infecting their family members and acquaintances in daily settings. This is why we need your cooperation, with many citizens having already reduced their gatherings.
The official, however, also cited data of citizens' movement across the country that actually seem to show the opposite when it comes to gathering or traveling due to the vacation season. Between July 19th and the 25th, movement around the nation increased by 0.8% from the week before. Breaking it down by capital and non-capital regions, it's 1% and 0.7% respectively. Son mentioned that by next week's weekend, the goal is to achieve a downward trend in the capital region. So with this situation, faster vaccination is what people are looking forward to. We will have more details on the vaccination supply in our next corner later on. But what has started according to plan this Wednesday is the inoculation of teachers of elementary third graders to third graders at middle schools, as well as other caretakers. And so far, we've got almost 35% of the nation's population who got at least 1 dose of COVID-19 vaccine. And now let's shift over to the international updates. We've got here the 20 countries with the highest number of infections, and we are seeing a country that has surpassed the 6 million mark in cases. Here, France becoming the 5th country around the world to surpass that milestone. And now let's take a closer look at some places in Asia today. In neighboring Japan, first off, not only are records being broken at sports events, just days after the Olympics kicked off, host city Tokyo hit its highest highest number of daily infections since the pandemic began, with more than 2,800 cases on Tuesday, surpassing 200,000 in total. The country as a whole reported more than 7,000 cases for the first time in 6 months. Meanwhile, Thailand also set a daily record of more than 16,500 infections reported on Wednesday, currently being the country with the 45th highest caseload in the world, which used to be a role model in COVID-19 prevention. And another nation that used to have that title, Vietnam, is struggling with its fourth wave of the virus, posting over 7,900 infections on Tuesday, remaining at the 7,000 level for the 5th straight day. Also, Indonesia, although having observed a decline in infections compared to devastating figures weeks ago, reported over 2,000 COVID-19 related fatalities for the first time on Tuesday. And also in overall, we are seeing a rise in infections around the world, as in the past 24 hours, as of noon Korea time, we're seeing over 634,000 new cases. And those are the updates I have for now. Back to you, Sunny.
All right, so as always, thank you very much for the detailed coverage.
My pleasure.
Right, we turn to neighboring Japan now, where the Tokyo Olympics are in full swing. Amid that is a rampant resurgence. For more, I have Kosuke Takahashi live on the line. Kosuke, welcome.
Hi.
Right now, as I mentioned earlier, Tokyo recorded a fresh daily high over the past 24 hours with more than 2,800 new infections. Let's begin with the COVID-19 situation in the host city.
Yes. Japan is currently facing a 5th wave of COVID-19 and remains under 4th state of the emergency for Tokyo. We are seeing an alarming spike in coronavirus infections and hospitalization across the Tokyo metropolitan area. Yes, just yesterday, daily coronavirus cases in Tokyo hit a record high with 2,848 new infections. Other prefectures such as Okinawa and Saitama also reported a record-breaking figures yesterday. Talking about the Olympics, as of today, the Tokyo Organizing Committee has reported 169 infections among athletes and staffers since the beginning of July. Out of them, more than 50 cases have been confirmed related to athlete village and stadiums. Sunny?
I see. Kosuke, despite the alarming spike that you just mentioned, the International Olympic Committee, that is, has eased its mask mandate for medalists. Could you tell us a bit more about this?
Yes, according to the playbook guidelines, medalists are required to wear masks on the podium to be photographed. But on Sunday, the IOC suddenly changed its policy by allowing medalists to take off their face masks for just 30 seconds for the photo session. IOC said the change will allow athletes to have an image for the media that captures their faces and their emotions during a unique moment in their sporting career, as well as to celebrate achievement of the all medalists together. That's the reason.
I see. Now, Kosuke, as you mentioned, quite a number of people related to the Olympics have tested positive for COVID-19. Are prevention measures within the Olympic Games arena being properly followed?
I think no. The so-called bubble system at the Tokyo Olympics to control COVID-19 is, I would say, already broken. The number of infection cases I mentioned before is showing its loose falls. The infection in athlete village is showing a loose falls in the bubble system. Staffers, athletes, journalists, delegates of each nation are supposed to be within the bubble, but some of them even go to convenience stores near their hotels to buy food and drinks. Last week, I went to Haneda Airport to check if the bubble system is really working. And then I saw the UK and US teams are arriving at the Haneda Airport, and then general public and athletes are simply mingle in many places, and then they are breathe the same air. So I would say so much for a bubble.
I see. Kosuke, there's also been quite a bit of international coverage of the scorching summer heat in Japan, challenging overall Olympic performance. What more can you tell us?
Yes, Japan is experiencing a very extremely hot summer every day. Heat stroke has always been a big social and health problem in many years in Tokyo. Olympics athletes, especially tennis players, are mostly complaining about this hot weather. And then athletes such as Novak Djokovic, the number one tennis player, are demanding to change the starting time of their games from midday to evening to avoid the daytime heat. In response, organized committee sports director Mikako Kotani stated like this: "We understand the concern about the heat. We would like to discuss it immediately." She said this, but it's too late to think about it from now on, I think, Sunny.
Of course.
And then, I guess.
No, go ahead, Kosuke. You're going to say something.
Then, as for the typhoon is approaching, right? So IOC decided to change the schedule of some game sports, such as the surfing, to avoid the typhoon. It moved up the schedule for some games, including surfing. Tokyo heat and typhoon are compounding Olympics complication. Both Japanese and foreign media have reported Tokyo 2020 is cursed Olympics. Sunny?
Right. And before you go, Kosuke, do share with us some of the stories that you're covering related to the 2020 Summer Olympics.
Yes, I have covered a couple of stories on the Olympics. First, I contributed an opinion piece to UK Guardian. I basically wrote the Prime Minister Suga is taking a dangerous political game and gambling too with the health and lives of the people of Tokyo and Japan, as well as the lives of the tens of thousands who will travel to games from abroad. I think Suga is counting on Tokyo Olympics to boost his approval rating ahead of the general election for the lower house and also the Liberal Democratic Party's election for the presidential leader. Both of elections will be held this autumn. And then I also write about the Mr. Kentaro Kobayashi, director of the Olympic Games opening ceremony of the Olympics, who used to make a fool of a Holocaust on the stage as a comedian. It's taboo, right, to use Holocaust as a comedian gag joke. So I wrote it, and then I was the first to wrote it. So and then he was dismissed. But many right-wing people attacking me because I wrote first. So there is a sharp division between society, people who support Olympics, people who are not supporting Olympics. So this is going to be after effect of in Japan after the Olympics, I think, Sunny.
I see. All right, Kosuke, well, do go ahead and raise awareness for us, and thank you very much for your time.
Thank you. 대단히 감사합니다.
Right, back on the local front now, seasonal factors here appear to be keeping infection numbers relatively high. And for more on this, on the COVID-19 situation that is here on the local front, I have our Ji Abili in the studio. Welcome, Ji.
Hi, Sunny. So as you mentioned, Korea's countryside is seeing a boost in the number of visitors from the scenic Gangwon province to the resort island of Jeju. With the record temperatures in the cities, the summer holidays are affecting the infection rate. So has already mentioned the rise in figures, so let's delve into the other takeaways from Tuesday's briefing. The latest KDCA figures show the breakthrough infections have only been reported in 14 out of every 100,000 people inoculated in Korea. So far, some 5.5 million people have been vaccinated in the country without anyone dying from the breakthrough infections. By vaccine type, more than 400 people who received the Janssen vaccine and some 170 recipients of the AstraZeneca and Pfizer vaccines respectively showed these symptoms. Here's what KDCA Director Lee Sang-won had to say about the breakthrough infections.
Breakthrough infections can occur with any vaccine, so we cannot say they're anything worth noting in and of themselves at this point in time.
Still, he added, the rate of breakthrough infections caused by the COVID-19 vaccines available in Korea is extremely low. Even in the case of the inoculations leading to breakthrough infections, the jabs still lower the likelihood of deaths or serious illnesses from COVID-19.
Right, and staying with vaccines, G, I hear more shipments are coming into the country.
That's right. So the Pfizer and Janssen vaccines arrive on Wednesday and Thursday, but a slight delay is expected for the Moderna vaccines. Approximately 2.7 million doses of the Pfizer vaccines arrived at the Incheon International Airport today, which completes the delivery of the contracted volume for the month of July. There are more Pfizer vaccines scheduled to arrive for the next month. On Thursday local time, 101,000 doses of the Janssen vaccine will arrive. Turning to Moderna, the American pharmaceutical company informed Seoul of a production issue for the doses scheduled for shipment within this month. The two sides have agreed to postpone the shipment to August, in addition to the amount already scheduled for that month. Prime Minister Kim Boo-kyum said Moderna will resume the shipment to Korea next week. Kim shared the updates from last night's meeting with Moderna during Wednesday's morning's regular briefing. Korea has a contract for 40 million doses of the Moderna vaccine, of which only about 1.1 million have arrived so far.
The government will continue with the scheduled inoculations without hesitation to reach herd immunity by November.
Right, and elsewhere, G, the spread of the Delta variant has been fast and furious.
That's right, and unfortunately much faster than the experts had expected. Initially, Washington and Brussels had forecast the Delta variant to make up about 90% of all variant cases by late August. But as of now, the latest variant is already making up close to that figure around the world a month earlier than expected. Even countries with a high level of vaccinations are seeing a rise in Delta variant infections, leading to some governments rolling back their mask mandates and other restrictions. For example, in the U.S., 12 states, Washington, D.C., and 4 territories have mask mandates now. The KDCA emphasized that existing prevention strategies like social distancing and mask wearing, in addition to vaccinations, are the best ways to contain the spread. That's all from me today. I'll be back next week.
All right, G, as always, thank you very much.
Thanks for having me.
Right, wearing face masks, washing hands frequently, and working from home. These are some of the new norms amid the pandemic. And while they are keeping COVID-19 at bay, they're also leading to a fresh host of other physical discomforts. Do take a look.
Hi, please come in. The COVID-19 pandemic has changed almost every aspect of our lives, and as you can see, I spend most of the time at home because of the social distancing measures. But did you know that it could actually affect our health?
The number of people spending their time rather at home has increased significantly since the pandemic broke out. And because of that, people have been less physically active. In fact, studies by the Korean Society for the Study of Obesity showed that people are exercising less than usual, resulting in weight gain. And health risks linked to obesity have become major social issues.
비만은 그 자체만으로도 질병이라고 할 수 있으며 고혈압, 이상지질혈증, 당뇨병과 대사증후군의 발생을 높이게 됩니다. 지난해 국민보험공단의 자료에 따르면 전체 인구의 39%가 비만 판정을 받았는데요. 특히 소아비만의 경우 10% 이상의 증가 추세를 보이고 있습니다.
Regular exercise prevents major health challenges, but it is hard to work out at public sports facilities because of the distancing measures. So the Culture Ministry has unveiled the stay-at-home exercises to encourage people to increase their physical activity. To stay active, you are recommended to exercise at least 30 minutes of cardio or weight training a day, and practicing social distancing while exercising, of course, should be the top priority.
Wearing a mask is a must nowadays, but wearing it during the summer can cause serious skin problems.
마스크와 연관된 피부염의 가장 흔한 증상은 피부가 붉고 각질이 생기면서 건조하고 또 가려운 것입니다. 여드름이나 뾰루지와 비슷한 발진이 생기는 경우도 흔하고요. 또 기존의 얼굴에 아토피 피부염, 지루 피부염, 주사 등이 있는 환자분들은 병변이 더 나빠져서 우시기도 합니다.
you are recommended to change your mask to a new one after wearing it for more than 6 hours. Also, during hot weather in particular, masks can be too damp from heavy sweating. So it is recommended to take off your mask for about 10 minutes every 2 hours and take a break. Good hand washing is the first line of defense against everything. Using hand hygiene product is effective, but excessive use of such products can damage the skin barrier, so it is important to follow safety precautions.
무엇보다 중요한 것은 손을 씻고 난 뒤에 바로 보습제를 바르는 것입니다. 또 최근에는 보습제가 포함된 손 세정제가 시중에 많이 나와 있기 때문에 가능하면 이런 종류의 제품을 사용하는 것이 좋고요.
So it's super hot outside, and I am pretty sure that you are using a lot of air conditioning during this hot summer. But it can cause air conditioning sickness, and its symptoms are similar to early symptoms of COVID-19.
특별한 연관이 없이 오랜 시간 에어컨에 노출된 후에 나타나는 가벼운 증상일 경우에는 먼저 몸을 따뜻하게 해주며 충분한 휴식을 통해 증상이 좋아지는지 살펴보는 것이 좋겠습니다. 발열 외에도 심한 근육통, 그리고 호흡곤란, 가슴 통증과 같은 심각한 증상이 동반되거나 후각 또는 미각이 상실되는 것과 같은 코로나19 감염의 특이적인 증상이 동반될 경우에도 검사가 필요합니다.
To prevent sickness related to air conditioning, set the temperature between 22 and 26 degrees, avoid wind blowing directly on your skin, and frequently ventilate indoor spaces.
We are all having difficulties because of the pandemic, but it would be still wise for us to boost our immune system by choosing healthy lifestyle, and it will definitely help us get through the situation. This has been 신세병.
Will move away from legal restrictions and allow people to make their own informed decisions about how to manage the virus.
The ECDC is telling us that 70% of the new infections are projected to be due to this variant in Europe by early August.
The current resurgence in many parts of the globe is casting doubt and hopes for an end to the pandemic. Accordingly, a number of countries are opting to chart a course to coexisting with COVID-19. For more on this, I have Dr. David Kwok from Suncheon University Hospital. Welcome back, Dr. Kwok.
Good afternoon.
And joining this session virtually is Professor Kim Hyun-chul at the Hong Kong University of Science and Technology. Good to have you with us, Professor Kim.
Hi. I'm Brian Kim.
Right, and I also have Dr. Borame Sue Lee Dickens at the National University of Singapore joining us live as well. Pleasure to have you with us, Dr. Dickens.
Good afternoon.
Right, we'll start here in the studio then. Dr. Kwok, I understand smallpox is the only human disease that has been eradicated via vaccination. First then, could we start with the definition of disease eradication?
Well, the definition probably would follow the definition of the word itself, eradication. Eradication usually means complete destruction of a structure that it no longer exists. Eradication of a virus will mean the same thing, that a complete destruction of the virus and it will no longer happen naturally and it will no longer be seen by human beings. So the eradication of COVID-19 would probably mean that we would no longer see a single case happening in the whole world. Maybe only for scientific reasons we would keep the virus, but I'm really talking about definitions here. But if we go back to the history of smallpox and how it was eradicated, since the WHO started the eradication program in 1959, it took them about 21 years before it was declared eradicated in 1980. So it took them about 20 years, and it wasn't really solely due to a country really working hard for it. It was actually a global community working all together very finely to have the virus under control. I am not saying that it's what's going to happen with COVID-19, but its eradication of a single virus is that much hard and very hard to achieve. So we have to give it a little bit of thought of how we are going to manage COVID-19 here.
Right. Professor Kim, as an academic in the arena of health economics, what do your numbers say about the possible eradication of COVID-19?
Right. So if you imagine the eradication of smallpox, that's not going to have which is completely disappear from the earth, as Dr. Kwak mentioned. This is unlikely to happen. I guess COVID-19 will be eliminated from some countries temporarily. This is temporary because immune level will go down eventually at some point, and the new variants that existing immunity is not likely to work will come out. So as a result, without a perfect border control, which is definitely not ideal, there will be continuous reintroduction, maybe seasonal, from the countries where vaccine coverage is lower and the public health measures are not good enough. Therefore, we have to find a way to live with COVID-19 as a risk that we can manage and we can afford.
Right, which is probably why over in Singapore, Dr. Dickens, authorities there have adopted a new approach to the pandemic by seeking to learn to live with COVID-19. Do tell us more about this approach.
Right, so I think Singapore is not alone in this. Globally, there's this general move now to increase acceptance of COVID-19 as being something that is endemic, and that basically means that we are here for the long run. So overall, there's this general attitude now, not only among academics, but policymakers also, to gradually increase the number of social interactions taking place in a controlled manner. So we have a three-prong approach here. One is which is to restore the economy and travel as soon as we can, but in a sustainable and safe way. Another one is looking at healthcare protocols, how we manage our cases in a way which is both cost-effective and efficient, and making sure that we don't see severe cases increase. And last of all is to change the psychology within society. So what that means is how people view COVID. We want people to view COVID as another endemic illness, much like influenza, and that it can be managed safely by policymakers, but not only in Singapore, but globally.
I see. And Professor Kim, how do you explain the adoption of such pandemic exit strategies by countries like Singapore and the UK?
Right. So the decision makers in these countries are, I think it is a good idea. They focus more on the number of deaths, not number of cases. Like vaccine decreases the fatality rate by more than 90%. The reason why they lift up these regulations is high vaccine take-up, especially for the people aged 50 and over. Like for example, in UK, the high risk group vaccine take-up rate is about 90%. Due to the Delta variant, number of COVID-19 infections in UK has been significantly increases, almost 10 times recently. However, the death rate, the number of deaths increases just slightly. And most of them are the elderly who refuse to take vaccine. And lastly, what is very interesting is that number of infection itself has been decreasing even after UK government lifts up these regulations. Although we have to wait and see just a little bit more, but take a discount altogether. If the vaccine take-up rate is high enough, especially for the risk group, I think we can consider the public policies to move forward with to live with COVID-19.
Right. Dr. Kwak, how do the birth then of new variants look to affect efforts by authorities to restore a sense of normality?
Well, I'm hoping that it'll be minimal. But because the disease or the virus itself is not currently thoroughly known, there's no way of really anticipating how much of an effect a new variant is going to affect us in the future. For instance, Delta variant clearly seems to be much more transmissible. We have no idea whether or not it is actually causing more severe disease or whether higher mortality. We are, as Dr. Kim mentioned, we're clearly seeing lower mortality rate despite the spike in the numbers. But that's probably partially due to, as Dr. Kim mentioned, high inoculation rate among more exposed people. There is a chance, there's a scientific chance that a completely new variant still may cause even higher transmissibility as well as higher fatality and more severe disease. It's just unpredictable. So for the time being, all we know is that vaccines do protect us from becoming way much more severe and possibly dying from the disease, and it probably will protect us enough for any of the new variants that are to come yet. But there is no guarantee that that'll stay in such fashion. So we still have to be careful making decisions whether or not we could implement easier guidelines for ourselves, forecasting that the new appearing variants will be the same as the variants that have appeared before. But also, as Dr. Kim mentioned, what's more important is the coverage of more vulnerable people. I was going to mention it a little later, but the UK and Singapore can now talk about easing their distancing guidelines because they have already covered about at least 50 to 60% of the percentages of the whole population with completion of the vaccination, let alone having inoculated the more vulnerable generations and other people already. So we're not at that point. We have barely covered slightly more than 30% of the population with only the first shot. And with second shot, we have slightly covered more than about 12 to 13% of the population. We're way behind the schedule comparing ourselves to countries like the UK and Singapore. So we have to really make careful decisions and careful discussions when we're discussing easing the guidelines for ourselves.
Right, and we'll get into that later on as well. But Dr. Dickens, keeping in mind what Dr. Kwok has just said, given the coverage, the inoculation coverage that is of the public in Singapore, what can you tell us about the COVID-19 situation there right now, amid global efforts that is to fight the Delta variant?
Right, yeah, so what Dr. Kwok mentioned is completely correct. So we are focusing now on increasing our vaccination rate, especially among seniors. So we have about 70% of seniors have received 2 doses so far. We want to increase that ideally up to 80%, if not more. So at this point, we are currently under a phase 2 heightened alert, which essentially means that we have restrictions ongoing in terms of how much we can socially interact with each other. And this cannot be sustained in the long run. And there's this general fatigue among the population for these continued control measures ongoing. So I guess from moving forward now, we should expect to see clusters. And we've seen KTV clusters, which is the equivalent of clubs, and also one at a fishery port. So the government now is, I think, using this current control measure to try and boost vaccination rates as much as possible, with the long-term view to try and implement some sort of, program would be appropriate to say, so we can manage cases and clusters when they emerge without having to put a complete population lockdown each time we see new clusters emerging within Singapore.
I see. And Professor Kim, given the prolonged pandemic, I hear you believe that the number of critically ill patients and that of COVID-19 fatalities are more important than that of confirmed cases. Would you care to elaborate on this, please? I think you mentioned it earlier as well.
Yes. We already live with many infectious diseases. To control for mortality and morbidity of the infectious diseases is not special at all. Think about other infectious diseases like influenza. People are not aware of the number of infection, hospitalization, or even deaths. We just got the vaccination before winter comes, and I think in the end, this is the way for us to go with COVID-19. And we counted the number of cases of COVID-19 because we did not know much about these diseases in the beginning of the pandemic. But now we know much about the COVID-19, and now is the goal for COVID-19 control is to make the COVID-19 as fatal as influenza which is about 0.1 to 0.2% fatality. And the influenza number of deaths is about 2,000 to 3,000 in Korea. But at the beginning of the pandemic, the COVID-19 fatality is about 2 to 3%, which is more than 10 times higher than influenza. But however, as the treatments become sophisticated and the vaccination has been introduced, the fatality has been decreases significantly. It came 0.5% in the spring and 0.25% last month in Korea. This is slightly higher than the influenza now. So now I'm saying that this is a time to move our focus from the number of cases to the number of hospitalization and the deaths.
I see. And staying with that, well, going to the issue that is of coexisting with COVID-19, Dr. Dickens, do you support Singapore's strategy?
Personally, yes. At this point, I think this is the final drive to get as many people vaccinated as possible. We have to do things step by step here. So the population is very risk averse in the sense that we can't just lift all the restrictions and expect thousands of cases. It will not be tolerated by the local population or policymakers alike. So we are trying to implement things in a very stepwise fashion, and we're trying to gradually loosen up the restrictions so we can have more social interactions and a sense of normalcy. So Singapore did very well in the past year, but this new advent of the Delta variant means that we have to be very wary moving forward. I guess by hopefully next year, we're looking at having a sense of complete normalcy, but we have to be always heightened in terms of being socially responsible and being that we have to keep wearing masks. We have to be aware that if you are or suspect you're infected, you must isolate yourself. And moving forward, we should always be open to the idea of taking vaccinations and when they become available. And when booster shots become available, I think Singapore will be one of the first candidates to say we'll be willing to entertain and vaccinate our population to the maximum level of protection we can possibly achieve.
Right. And Dr. Kok, where do you stand on the issue of coexisting with COVID-19?
Well, I think in the natural course, it may be much harder to think about complete eradication of the virus. So I think eventually, in the long run, coexisting or co-living with the COVID-19 virus is inevitable. I think we are going to head that way anyways, whether we want it or not. But as I've mentioned before, I just want to reiterate the fact that the countries that are currently talking about easing the restrictions can only do so because they have the most vulnerable people covered. We don't have that yet. So we have to really focus on how we are going to achieve such level so that we can start talking about how we're going to manage the virus to not spread further in the future. Also, if I may take a moment to compare the virus mortality rate to the influenza rate, we have slightly reduced mortality rate currently, judging from the accumulation of the cases, about 1.1% of the mortality rate. As Dr. Kim mentioned, compared to the 0.1% of the mortality rate of influenza, it's still almost 10 times high. Of course, that's from the accumulation of the numbers, so we might be seeing a lot lower number currently, but that's also because we have very strict social distancing guidelines. If we compare ourselves to the country like India, where they had massive cluster infections, they tend to cause much higher mortality rate as well. We are seeing this lower number because not just the vaccination, we are also seeing it because of the very strict social distancing that we are currently keeping. But once we let it go, as we have seen from cruise ships, as we have seen from the marine ships, once it's becoming confined and massive numbers are gathered to spread it around, we are also very likely to see much higher mortality rate. So now is not the best time for us to really go ahead and start thinking about coexisting with the COVID-19, but rather we should get ready for ourselves how we're going to achieve that level so that we can start talking about the issue.
Of course. And Professor Kim, what about in Hong Kong? Is it charting a course to coexisting with COVID-19, or is it still seeking to contain the spread fast?
The Hong Kong situation is kind of not ideal. Although the the vaccine incident, the COVID-19 instance is near zero, but the vaccine take-up rate is low. So in the end, the outbreak will come out, but vaccine as vaccine take-up rate is still low, there is no way to prevent the future breakouts. So that's somehow the Hong Kong government's government problem.
I see. Dr. Dickens, I'd like to direct your attention to the situation here in our country, in Korea. What is your assessment of our fourth wave?
So I think it's a cautionary tale, and Korea is certainly not alone in this. I think every country has had to learn this very much the hard way. When vaccines became available, there was this general hesitancy and then a mad rush to try and secure supplies. Korea, unfortunately, was not one of the winners of that, and therefore is lagging sufficiently behind in terms of its vaccination rates. So I would say that moving forward, Korea is now having the positive outlook of let's vaccinate as many people as we can while maintaining a level of social distancing. I think moving forward, if Korea, keeps up this vaccination rate and this urgency to keep people going for vaccination, it should come under control in the long run. But looking back, I think Singapore included also made mistakes early on in the outbreak. There should be this general lesson learned that we should be much more pro control measures before it comes to the point where we're looking at nationwide outbreaks, which is what we're being observed, I guess, globally at this point.
Right. Professor Kim, keeping in mind what Dr. Dickens has just said, what prerequisites then have to be met here in Korea to perhaps better pave a path out of the pandemic in the future?
Right. So before address your question, I'd like to echoing the Dr. Kwak's point, which is really important. So we should achieve the 80 to 90% of the vaccine take-up rate of the risk groups. That's the most important prerequisite for the way to move to live with the COVID-19. But there could be more things we can consider because of the psychological things, and our society must be prepared to move forward when the vaccine take-up reaches 80 to 90%. I'd like to propose three policies must be stopped, and we also have to introduce or maintain another three public policies. So number one thing we have to stop is to announce the daily confirmed case. Announce the daily confirmed case every day. This is not definitely the number of cases is not the best way to measure the severity or intensity of the break. The age composition is important, and the mortality is much more important. But we are overwhelmed on these numbers. Another one is that the facility quarantine of the positive cases should be stopped. It must be changed to self-treatment at home, and we also have to consider to stop contact tracing, which is not sustainable way to address this pandemic. However, we have to keep three policies. Number one is wearing mask, indoor especially. So this is really important. And also we have to consider treat the COVID-19 patients in the general ordinary hospital system, not in the special treatment system, which is not sustainable at all. And the last one I'd like to propose is that the degree of the social distancing must be dependent upon the number of hospitalization or deaths, not the number of positive cases. These kind of things must be go ahead before we completely transit to a life with COVID-19.
Right. Dr. Kwak, keeping in mind what Professor Kim has just said, what does Korea then need to consider? Should it plan to tailor its own exit strategy? Because we need one in the future.
Well, we will eventually do need it, but currently, I have no other words but to emphasize the fact that we still need to catch up on the vaccination rate. That's number one get-go. if we want to talk about anything else. Number one, we have to vaccinate all the people that are more vulnerable to the disease so that we can start thinking about something else. We have to have them covered and protected. Number two, I believe there are a couple of other regimens of treatments that are being currently studied that are showing great potentials. When we were focusing into vaccines in the beginning of the pandemic, it was a whole global community that came confronted and that conformed to come up with these vaccines and ideas for vaccines, and we eventually did come up with vaccines that showed great efficacy. I believe there are a couple of other oral regimens that are showing great results also. Korea as a country, if we can step in advance and maybe delve into the study of those, we would have two swords to fight against the virus, not just the vaccine itself, which means a stronger power for us in the whole battle against the disease itself. So we would have to think about not alternative, but an addition method of fight and means of fight in the battle against the virus. So for the future of Korea, I believe we do need to catch up on the vaccination rate, but also start thinking about addition of other possible treatment regimens as well.
Right. All right, Dr. Kwok, as always, thank you very much for your thoughts.
Thank you.
Dr. Dickens over in Singapore, thank you very much for your time and your thoughts. And Professor Kim in Hong Kong, thank you for your insights.
Sure.
Right. Well, one general consensus among health experts here today is that vaccination will serve to facilitate life with COVID-19. So thank you for watching. See you on Thursday.